Welcome back to our three-part recorded series. This is part two. We'll be covering Original Medicare. If you want to reach out to us or schedule an appointment, email us at medicarecounseling@bouldercounty.gov or give us a call at 303-441-1546. Make sure to leave an email address as well. Okay, what we're going to cover in this section of the three-part series is Original Medicare Parts A and B, what the premiums, deductibles, and coinsurance costs are, what coverage you can add to that Original Medicare, and Part D prescription drug coverage. Enrolling into Medicare Part A and B is where you start your journey with Medicare. Enrollment is done through Social Security because they have your work and your tax records. Part A is your inpatient hospital coverage. Part B is your medical coverage. When Parts A and B are combined together, they're called Original Medicare. You'll hear that term a lot. Original Medicare Part A and B is portable. There's no referrals needed. It's not managed care. It's accepted nationwide, so you can go to any doctor that accepts Medicare anywhere in the U.S. or the U.S. territories, any hospital, clinic, or provider that accepts Medicare. And it's really important to understand that there are no referrals needed to see specialists under Original Medicare. Under Original Medicare, Part A is generally premium free for most people or anybody who has been paying the Medicare tax through employment for roughly 10 years. It's 40 quarters or 10 years of work history, and then Part A is premium free. Part B does have a monthly premium. It's $185 per month in 2025. That changes each year a little bit. Usually the new premiums come out around November. There are deductibles and there are coinsurance costs in Original Medicare, and really important to know that there is no maximum out-of-pocket limit. So there are ways to add coverage to your Part A and B to help with those costs, but if you have a $100,000 bill and all you have is Medicare Part A and B, 20% of that cost is going to be yours. If that happens the very next weekend, again, likely 20% of that cost will be yours with no maximum out-of-pocket limit. So we'll talk about ways to cover those costs, but if all you had is A and B, you'd need to know that your costs could be quite high. So these are the monthly premiums for the different parts of Medicare. Part A and B would be paid to Medicare. A would be at no premium if you have 40 quarters of work history or 10 years. If you have fewer than 40 quarters, you may pay a monthly premium for Part A. Part B is $185 per month plus any income-related adjustment. And we'll talk about that on the next slide. Part D is paid to a private insurance company who contracts with Medicare, and these premiums vary from plan to plan. Part D can also have an additional income-related adjustment. So this is the IRMA chart. This is the 2025 chart. This does change a little bit every year, but it's the income-related adjustment amount. It's a surcharge amount based on your tax return 2 years prior. So if you are enrolling in Medicare in 2025 and your tax return in 2023, as an individual, your modified adjusted gross income was more than $106,000. You would pay the $185 plus $74 surcharge on your Part B, and then you would pay an additional $13.70 on top of any premium you might have for your Part D coverage. So you're going to add the $185 here. If you're in this bracket, A little bit hard for me to write with my mouse, but if your income as a couple, they basically double it, is 212,000 or more, between that 212 and 266,000, you're going to pay an additional $74. If you're all the way down here, yay to that. Um, but if your income is greater than 500,000, you would pay an additional $443.90 on top of the 185 and an additional $85.80. This readjusts every year, so Social Security is always going to be looking at your tax return 2 years prior. You may pay IRMA surcharge 1 year and not pay it the next year. For instance, if you sold Grandma's Farm and you have a bump in your income in 2024, then likely you're going to pay an IRMA surcharge in 2026. You can't appeal this. Appeals are done through Social Security. You have to pay the IRMA surcharge while you're in the appeal process. If they find in your favor, then they will pay you back those funds that you've paid in. Again, this is a rolling look back, so it would change each year based on your tax return 2 years prior. If you have questions about this, we're more than happy to review it with you. Now on to deductibles. Part A has a deductible of $1,676. That's per 60-day benefit period. So if you're in the hospital for 2 days, admitted as an inpatient for 2 days, you're going to pay that $1,676. If you're in there for 59 days, it's still just the $1,676, which is a fantastic deal if you know anything about the hospital costs. You can pay this deductible more than one time a year if your hospital stays were spread out far enough throughout the year. Part B has an annual deductible of $257, and that is waived for your preventative services like mammograms, prostate screening, diabetes tests. Part D has a maximum annual deductible of $590. We'll talk about that a little bit more when we get more in depth on prescription drug coverage. Now on to coinsurance and what you pay in 2025 when you're using those Part A and B services. So Part A, that is your inpatient hospital benefit. You have to be admitted into the hospital as an inpatient in order to be accessing Part A benefit. And you're going to pay that one-time deductible for the first 60 days that you're inpatient. If you happen to be in the hospital longer than 60 days, which is really unusual anymore, but we did see some instances during COVID when people were in their hospital for a long time. On day 61, if you were there 60 days in a row, beginning day 61, you're going to start paying a per day charge. Skilled nursing, you're going to pay the $209.50 per day beginning on day 21. So see here, day 21 through day 100, you're going to pay a per day charge. So if you were admitted into the hospital and you had what's called a 3-night inpatient qualifying stay, the first 20 days at a skilled nursing facility or a rehab facility are covered 100%. And then if you're there longer than 20 days, you're going to start paying that per day charge on day 21. Part B is your medical insurance. This is pretty much everything else that you're going to be accessing and what we use most of the time. So under Part B, Medicare is going to pay 80% of approved Medicare services, and you're going to be responsible for 20% of the Medicare approved rate. Unassigned claims, this is really unusual to see. It does happen, so we want you to be aware of it, but don't really need to focus on that much because there are not that many doctors that accept Medicare but don't accept assignment. So what that means is that if a doctor accepts assignment by Medicare, that means that he agrees to charge only what Medicare allows for that service. There are some doctors that accept Medicare, but they don't accept assignment, and those doctors can charge an additional 15% above the approved rate. In that case, you would pay the 20% and then the additional 15%. So what all does Medicare Part A cover? It's going to cover the inpatient hospital care that we talked about on the previous slide. We'll also cover blood, home health care that is associated with an inpatient hospital stay, skilled nursing facility care, that we talked about also on the previous slide. You're not going to pay anything for the first 20 days if you were transferred from a hospital to a rehab facility and you had that 3-day minimum qualifying hospital stay as an inpatient. This is really important, just to make sure you have somebody asking if you are in the hospital. Just ask the question, am I an inpatient? Am I being admitted? Because it is possible to, go into the emergency room or have outpatient surgery or something and have them hold you overnight under observation. That's not an inpatient stay. So make sure you're asking that question, especially if you think you might have to go to rehab before going home. So home health care and hospice care are also covered under Medicare Part A. Skilled nursing is not a long-term care, and Medicare does not cover long-term care. A lot of people think it's going to cover their long-term care. They'll just say, oh, I'm going to let Medicare cover that. Just know Medicare does not cover long-term care. Medicare Part B covers pretty much everything else and those things that we're accessing on a daily basis. It's going to be all of your doctor's services, lab work, MRIs, CAT scans, x-rays, physical, occupational, and speech therapy, mental health therapy. Something that might be new is DME equipment, durable medical equipment. That is your walkers, wheelchairs, some insulin pumps, oxygen, CPAP machines. Those are all covered through durable medical equipment. And what's really important there is that you are going to a supplier that accepts Medicare. We have had people order wheelchairs from Amazon. Amazon is not a Medicare approved supplier. So if you do that, you're going to be paying the whole cost of that equipment. If you have any questions about that, we're more than happy to review it. Just wanted to make a note that up at the top of the slides, there are notations for what pages in the Medicare and You book that these services are covered or reviewed in that book. We have some Medicare and You books. If you'd like us to mail you one, just leave us a message. Let us know that you took the recorded class and you would like us to mail you a Medicare and You book or send us an email. We're more than happy to do that at any point in time. It's kind of a good reference to have on hand. This is just a review of what you're going to pay under Original Medicare for Part B services in 2025. So you're going to pay that first, the annual deductible. First time you receive services in the year, you're going to pay that first $257. And then after that, the rest of the year, you will pay 20% of the Medicare approved amount with no maximum out of pocket. This is a partial list of some of the preventative services. If you're receiving a preventative service, you will not pay the Part B annual deductible of $257. These are at no cost to you, no deductible, no copayment. You'll see that there are 25 pages in the book goes from page 30 to page 55, covering preventative services. So there's a lot of information in the Medicare and You book about these. But it's going to cover most of your vaccinations, the COVID-19, Shingrix, pneumonia, hepatitis vaccinations, bone mass measurements, mammograms, prostate screening, and colorectal cancer screenings. Now, the colonoscopy, if they do the look-see and they don't find anything, that would be a preventative service. If they do the colonoscopy and they snip a polyp and send it out for diagnostic, then that will fall into the Part B cost sharing um, benefit. Annual wellness visit. This annual wellness visit is really just a conversation with your doctor. It's not what we think of as our annual physical, but more just imagine sitting down across the desk from your doctor and having a conversation about your health and what maybe they want to follow during the year. You may then also have a medical appointment in which they do all the things you think of as your annual physical, taking your blood pressure, ordering lab work, that kind of thing. What is not covered is just as important. So dental care is not covered by Medicare. This is routine dental care, like having cleaning done. Cosmetic surgery, massage therapy, just a reminder, no long-term care or nursing home care is covered by Medicare. So routine hearing and routine eye care and eyeglasses is not covered by Medicare. A lot of people have questions about this because they'll ask us, well, what about cataracts or glaucoma? If you are having cataract surgery, that is going to be done by an ophthalmologist who's a medical doctor. That will fall under Part B. But if you're going to Target or Walmart or Pearl Vision to get a set of glasses or just have an eye exam, that's considered routine eye care. So, and done by an optometrist and not covered by Medicare. So just keep in mind that distinction, ophthalmologist, medical doctor, that would be covered. Acupuncture, we put this on here, but it's really only covered under very limited circumstances related to lower back pain. And what else? Oh, Medicare does not cover any health care outside of the U.S. or concierge care. So what do you do about that 20% in costs that you're responsible for paying? There are a couple of different options. You could purchase a supplemental insurance plan called a Medigap because it covers the gap between what Medicare pays and what you're responsible for. You may have retiree coverage from prior employment or TRICARE for Life or Federal Employee Health Plan or union coverage, or you might have low income and possibly qualify for Medicaid that could pick up those costs for you. We're going to go into a little bit more detail on supplemental insurance plans coming up. Medigap supplemental plans are sold by private insurance companies. They're standardized nationwide, so if you purchase a Plan F, a lot of people have heard about a Plan F. If you purchase a Plan F or have a Plan F, it's going to cover all the things that a Plan F covers, no matter what company you get that plan through. And it'll go with you wherever your original Medicare goes. So if you're traveling to Texas and because you want to see a doctor at MD Anderson and you have original Medicare and a Medigap, you can do that. It's very portable. If you're going to live in a van for the next year, you might want to have original Medicare and purchase a Medigap to pay those costs you're responsible for. You have to have A and B in order to purchase a Medigap plan. And the first 6 months that you have your Part B benefit, you have guaranteed issue right to purchase a Medigap plan. This is really important because during that 6-month period, these plans cannot ask you any medical questions. They're just going to accept your enrollment as long as you pay those premiums They will never deny or drop you. So once you're in, you're in. This is the time to do it. If you know that you have delicate health, if you know everybody in your family develops cancer at the age of 70, if you plan on traveling around the country, if you're a snowbird, um, if you know that you want to see a doctor at the Mayo Clinic in Minnesota, this is the time to purchase it. Don't wait. Once you leave that 6-month period, that guarantee issue right period, these plans can't deny you based on your answers to the medical questions. And the reason they can do that is because they're not your primary insurance plan. Medicare is your primary insurance. This is a secondary policy that you're purchasing. So it's important to get one right from the start if that's the way you think you want to go. These are all the plans that are offered by Medigap companies. Keep in mind that Medicare is a part. So if you hear Part A or Part B or Part D, that's Medicare. These are plans. Plan A, Plan B, Plan D. Anything that has a black check mark is something that is covered by this plan. Plan F, which a lot of people have heard about, no longer accepts new enrollees. If you turned 65 after 2020, January 1, 2020, you cannot purchase a Plan F or a Plan C. Plan G is the most comprehensive plan that you can purchase right now. It has the most check marks. If you just look down this column, you'll see there's a check mark in every category except for right here. And this is the Part B annual deductible of $257. You're going to pay that first $257 first time you access services during the year, and then the rest of the year Medicare is going to pay first, and your Medigap plan would pay second, and you're just paying premiums. These plans, they've recently gone up, so they're, I want to say if you are just turning 65, a female, you're probably looking at somewhere between, pretty wide range, but somewhere between maybe $130 and $170 per month to purchase one of these plans. These plans do go up every year. They increase, and it's based on the medical costs or whatever that company is paying out per dollar in claims. So it may have an increase. A lot of people are, after COVID, it was pretty quiet. A lot of people weren't doing elective surgeries, weren't going to see the doctor, so they didn't increase much. But in the last couple of years, they have had some pretty significant increases because of the number of people accessing medical benefits. Plan N is also a super popular plan. The Plan N, you're going to pay that $257 and possibly any excess charges if you were seeing a doctor that didn't accept assignment by Medicare. And then you will pay $20 every time you access a service or see a doctor. So that's this line down here for Plan N. You're going to pay $20 for every office visit, $50 copay for an emergency room. So when you're looking at a Plan N, you want to really think about how often do you access the services, and when would the $20 copayments outweigh the difference in the premiums between a Plan G and a Plan N. Plan G does are some companies that offer a Plan G high deductible. And if you purchase one of those are lower cost monthly. They're going to be more around $70 a month, 50 to 70 maybe. But you're going to pay the Part B annual deductible of $257 and then also the first $2,870. Once you've met that, then the high deductible health plan would go ahead and pick up all the rest of the costs second to Medicare. We're happy to talk about these plans with you in detail, and we have an actuarial system that we can give you an estimate on what the premiums will be. We can't enroll you in one of these because it's not Medicare itself, but secondary to Medicare. So you would have to go through either a broker, a sales agent, or direct to the company to enroll. So now if you have original Medicare with a Medigap, and what happens if you want to move to a Medicare Advantage plan in the future? Can you do that? Is it easy? It is super easy. You can do it any year during the annual enrollment period, which is between October 15th and December 7th for a January 1 start. Super easy. Yeah. So if you're planning on traveling in a van for a couple years, or maybe I want to get my hip replaced or knee replacement, and I know that I want to go to this particular doctor. Maybe you start with original Medicare and a Medigap, and then in the future, you're going to be staying more in the area and you want to move to a Medicare Advantage plan. You can do that any year that you want, and the new plan will start January 1. All right, we'll start talking about original Medicare. So we've enrolled in Part A, inpatient hospital. We've got B, our medical coverage. We've added the supplemental or the Medigap to cover those costs we're responsible for. So the only thing left to do is going to be to add Part D, prescription drug coverage. Part D prescription drug coverage, this is for medication that you're picking up at the pharmacy and taking at home. So anything you're picking up at Walgreens, King Soopers, it's an oral medication, you're taking it at home. There are some self-injectables that you might pick up at the pharmacy and take at home as well. So these are provided by private insurance companies that contract with Medicare. And each one of these Part D plans has its own formulary. So Part D plans, they do have monthly premiums. There are 14 different plans to choose from, and we'll show you what that looks like here in a second. Anywhere from a zero premium all the way up to, I think it's $151 per month. So why would you choose a zero premium plan over a more expensive plan? It would be because the plan that has a premium is the only one that has your particular medication on its formulary. So these Part D plans, they have a maximum deductible of $590 this year. If you're taking a generic medication, then generally that plan covers it right from the start without requiring you to meet that deductible. If you have a medication that's a higher tier level or more expensive, the plan will say, hey, we want you to meet this deductible before we're going to start cost sharing with you. So really, it's important to make sure that the plan you're enrolling with has your medications on their formulary. There are some kinds of restrictions with these plans. Really, you just want to pay attention to if the plan says that they were going to require step therapy. What that means is that they want you to try 2 or 3 other medications before they give you the one that you want that's more expensive. We can help you review these plans. We do it every day. We're familiar with what the plan finder looks like and all of the information that's provided there. Easiest thing to do is come to us and have us help you review this so you make sure that you get into the best plan for that year. Part D plans, you only have 63 days to get enrolled once you've lost coverage before a penalty starts accruing. The penalty for Part D is much less than the Part B penalty. It's 1% of the national average cost of a drug plan. So right now, it's about 37 cents per month for each month that you didn't enroll when you should have. It does add up over time, though. We see a lot of people that didn't take a Part D plan when they should have, and it's 5 years down the road, and now they're looking at, an additional $40 to $50 a month that they're paying because they have a Part D penalty. So best thing is to get enrolled when you're first eligible. If you're not taking any medications, enroll in the zero premium plan. And then you have the opportunity to change your prescription drug plan each year during the annual enrollment period. These drug plans have star ratings, and the star ratings are based on the plan performance, whether or not they drop drugs from their formulary, change pricing. So we'll look at that on the next slide. So this is the chart that shows all of the prescription drug plans that are available for purchase in Colorado in 2025. This column has that star rating that we talked about, and that's based on the plan performance, whether or not they drop drugs from their formulary or change pricing of certain medications or tier levels. Most of these plans stay pretty steady throughout the year. There's 3.5 is a good star rating. We've never really seen a drug plan that had a 4-star or higher rating. Here is the WellCare plan that has a 0 premium. This is a good little plan, especially if you're not taking any medications. I would say enroll in that. You have the opportunity to change your plan in the future during the annual enrollment period. And that WellCare works for a lot of people, even if they do have a lot of prescriptions. But here you're going to look at the annual drug deductible, which is going to vary from plan to plan. Mostly the drug deductible is $590 unless you're paying a higher premium. If you're paying a higher premium, then they may have a lower deductible. And know that you have to meet that deductible if you have a more expensive drug before the cost sharing begins with that plan. We're happy to go through these in detail with you and review your prescriptions. Make sure they're covered under the plan. Make sure you're getting the best option for you that year. I would say that if you're getting ready to enroll into Medicare or if you already have Medicare, then try to talk to your doctor in September or October to review your medications and know whether or not there's anything they're considering for you for the following year, just to make sure that we can review and make sure that it's on the formulary of whichever plan you might be choosing for the coming year. This is the standard Part D design for 2025. There are 3 different phases that you'll go through in a Part D plan, standalone Part D plan. In phase 1, that's when you're meeting that annual deductible of $590. Keep in mind that anything that's generic, preferred generic, their plan is going to cover right from the start without requiring you to meet that $590 deductible. If you have a more expensive drug, for instance, Eliquis is a tier 3 medication, a little bit more expensive. The plan will say, hey, we want you to pay this deductible before we're going to cost share for it with you. So once you pay that $590, then you're going to move into phase 2. In phase 2, you're going to pay a percentage of the cost of the drug, depending on the tier level, for a total of $2,000. That total of $2,000 includes the $590. So your maximum out of pocket on a drug plan in 2025 is $2,000. Once you've met that $2,000, then you enter phase 3, which is catastrophic coverage, and the plan pays the whole cost of the medications. You don't pay anything at that point beyond your premium if you had a premium. This has improved tremendously over previous years. Last year, the maximum out of pocket was $8,000. So this is part of the Inflation Reduction Act in reducing people's overall costs for prescription drugs. And we're really happy about this. So if you have an expensive medication, come to us and we'll help you review in detail what your costs are going to look like. These plans also have what are called payment programs. If you have an expensive medication, say your medication is an oral chemotherapy medication that's going to be $20,000 in the first month, and you go through phase 1 and 2 in that first month, it's $2,000, you can enroll into a payment program with the drug plan where you pay a monthly amount and defer that cost over the whole year. So we're happy to review that with you as well. Now, Part D does not cover some chemotherapy and immunosuppressive drugs because they're covered under Part B. Anything you're going to be receiving by injection or infusion in a doctor's office or a facility would be covered under Part B, not D. So if you're going to Rocky Mountain Cancer Center and you have infusions once a month or 3 times a week, that is going to be covered under Part B of Medicare. If you have an oral medication that you take at home, that is covered under D. So vitamins and over-the-counter drugs are not covered by Medicare, nor are weight loss, gain, or sexual dysfunction or fertility drugs covered under prescription drug Part D plans. So if you have prescription drug coverage currently, is it creditable? You may need to have verification of creditable coverage if you're over 65. If you're employed and receiving your health care coverage through your employment, most of those companies send out a letter letting you know that your coverage is creditable. You don't have to enroll in a prescription drug plan. We really think that you should, especially since there's an option for a zero premium plan. Get enrolled just in case something happens. We see that all the time. Somebody who didn't enroll in drug and then in the middle of the year all of a sudden something happens and their medication that they need is expensive. It's not a time of year when they can enroll, and then when they do finally enroll during the annual enrollment period, they're looking at having a penalty on top of everything else. So enroll when you're first eligible. Let us help you with that. We're more than happy to help. And then we just want you to know too that some retiree plans like federal employee health plans or if you had Paracare, they include drug coverage or they have creditable drug coverage within them. Some COBRA plans also have creditable drug coverage, even though COBRA is not considered creditable for not enrolling in Medicare Parts A and B. And as long as you have creditable coverage, you're not going to be penalized. Then we just want to remind you too that you only have 63 days to get enrolled into a prescription drug plan when your coverage ends. So don't wait the 63 days, please. You know, get it done in right away or let us help you and at least contact us before that 60 days expires. Don't wait. This is the Prescription Drug Plan Finder, PDP, on Medicare.gov. This is where if you want to do your own research, you can. You would click on this tab down here that says Find Plans Now. Either, create your own account by entering your Medicare number and all of your information, where you can then enter your prescriptions and it'll hold that information. Or you can do a generalized search by entering your zip code. Or you can come to us. That's probably the easiest way to do it. We'll do all the work for you and provide you with an analysis of which plans might be best for you. This picture on the Medicare.gov website changes frequently, but we're keeping her for the year. She was on the page in January, so she's going to stay with us for the presentation for the rest of this year. If you have any questions about this, just let us know and we'll kind of help guide you through it. But know that you can do the research on your own if you wish, or come to us and we'll help you. We're coming to the end of part 2 of our 3-part series. This is the end of original Medicare. So to be covered completely under original Medicare, you're going to enroll in Medicare Part A and B, and you do that through Social Security. Then you would choose a Medigap supplemental plan or have some other coverage that pays second to Medicare, and complete your coverage by enrolling into a Medicare Part D prescription drug coverage. Once you have all that, you are fully covered under original Medicare.